I'll provide an update on hospital numbers and cases, and then I'll go through a few changes to our policies that will come into effect over the next few days. There are currently 121 people with COVID receiving care in Territory hospitals. This represents about 2.4% of our active cases. There are 8 patients currently requiring oxygen in our hospitals, 2 fewer than yesterday, and we have 3 patients receiving care in ICU, 1 in Darwin and 2 in Alice Springs. We've had 2 patients leave the ICU since yesterday. To the new cases. There were 849 new cases of COVID-19 in the Northern Territory in the 24 hours to 8 p.m. last night. Yesterday's case numbers have been also revised up slightly from 828 to 879. Active cases in the Northern Territory now stand at around 5,150. About 57% are in the top end and 22% in Central Australia. We have a few local restrictions expiring today, and I'll run through them now. The lockouts for Alice Springs and Amungana, Yuendamu and Nulamu will end at 2 p.m. today as scheduled. We are introducing new travel restrictions to some remote communities from today. And restricting travel in and out of communities will increasingly be a bigger focus for us from now on, rather than lockdowns and lockouts, and I'll explain why in a moment. From 2 p.m. today, the communities of Bloodowich, Palumpa, Milingimbi, Milakarpiti, Elcho Island, including Galawinku, and Wessel Island, including Marchaba, will enter a lock-in for 7 days. Under a lock-in, there will be no stay-at-home requirements for people who are not positive cases or close contacts. You will be able to freely move about your community with the mask mandate and the vaccine pass rules in place. However, you will not be able to leave the community for the next 7 days unless you have an exemption from the Chief Health Officer. To help enforce this measure for the next 7 days, non-essential road and other passenger transport in and out of these communities will cease. Non-essential charter flights will cease, and roads linking the communities to our major transport roads will be monitored by police to ensure compliance. Failure to follow the Chief Health Officer's direction will mean a $5,000 fine. We've been trying to stop and slow the spread of Omicron with lockdowns and lockouts in several communities for some weeks now, with, I think, fair to say, limited success. This has also been the international experience. Lockdowns struggle to contain Omicron. There are 2 main reasons why lockdowns and lockouts are now less effective than they used to be. Firstly, Omicron is so much more infectious. Secondly, compliance with stay-at-home orders is no longer strong enough to justify them. That is in no way a criticism of locals. I want to be really clear about that. As we've said before, remote communities are more like one big household. That's just the reality. Many of us might relish the thought of 7 days by ourselves, but for many residents in Aboriginal communities with their very strong kinship bonds, that's another kind of hell. Omicron is too infectious, it moves too quickly. Given the difficulties in stopping the spread of Omicron within a community, our priorities now have to be ensuring we can limit spread between communities and focusing our efforts on caring for sick people rather than using up manpower and hours on enforcing stay-at-home orders for people who aren't sick or who aren't high risk. Stay-at-home orders will only apply to people who are positive with COVID and close contacts of a COVID case. As our numbers show every day, the overwhelming number of people getting COVID in the Northern Territory are not sick. They stay at home and they recover quickly. So we're going to put more of our effort where it is needed most, not keeping COVID negative people inside their homes, but caring for sick people either in their community or in a hospital. And that requires us prioritising testing and care for people who are unwell, close contacts, and people who are especially vulnerable to infection. Finally, a week ago, I told you that we would keep our testing requirements for interstate arrivals in place for as long as interstate arrivals were a higher risk of infection than local transmission. As expected, we have now reached the point where that is no longer the case. While every jurisdiction counts active cases a bit differently, our analysis indicates that active cases in the Territory as a proportion of our population is now roughly in line with the rest of the country, with the obvious exception of Western Australia. The peak of arrivals from interstate ahead of the return to school has now passed, and we are now very confident that the overwhelming majority of new cases in the Territory are being acquired locally, not from interstate. At this point, providing a test to a random arrival at the airport is about as effective as providing a test to a random person on the street in Darwin. That is, not effective. If interstate arrivals pose no additional risk to the Territory, it makes no sense to waste thousands of tests every day on people who are not unwell. Unlike other parts of Australia, the Territory has a secure supply of free rapid tests for Territorians who need them, and we want to keep it that way. So from Tuesday, We will cease the requirement to do 3 rapid tests in the week following your arrival in the Territory. Whether you are a local or a visitor, whether you haven't left the Territory for ages or you recently got here, the advice is simple and the advice is the same. If you feel sick, get tested. If you have any symptoms, get tested. Interstate arrivals will no longer be required to use the Good to Go app for 14 days, but every arrival does still need to complete a border entry form prior to their arrival, and unvaccinated people are still banned from entering the Territory without an exemption. This rule will still be enforced, including through checks at the airport. Moving to this new footing will also free up close to 100 frontline workers, including health staff and police, to focus on priorities. Now, I'm sure there'll be plenty of interest groups out later today to give you another round of headlines on how all of these decisions are totally terrible. Not surprising, that's been happening for 2 years now. We've got groups on one side telling us our measures are too weak and we need to do more, and even if it's not effective, just for appearances. And groups on the other side telling us to remove all restrictions, like masks, and just let Omicron rip. Believe it or not, we don't spend hours every day poring over the data and agonising over these decisions just to piss people off. We will keep doing what we've been doing for 2 years, following the health advice, putting our resources where they are most effective, being flexible and getting the balance right. Acknowledging the reality that COVID is here and not going away, but all they need, and other Territorians get as much freedom and normalcy as possible. Thank you.
Thank you, Chief Minister. So we've been preparing for this for 2 years, and our plans over that time have been reviewed again and again. The Territory has done extremely well through the whole pandemic, and we've been very agile, and I can tell you that the monitoring of what we are seeing internationally, nationally and locally is a very dynamic thing we do, and so many hours in the day and night. So the one thing I want to say is that at the moment this is a very appropriate approach. The main thing is to understand that the controls that are there and mask wearing, and I've got to thank the whole community for coming along with us with our current wearing of masks outdoors. We've reached actually, I think, a peak in our outbreak, and I believe that it is likely this is mostly Omicron. There are other variants that we need and monitoring for, such as the BA2, which does not seem to be any more infectious. But as the Chief Minister said, Omicron is extremely contagious. So hence the controls of masks, stay-at-home orders. If you are positive or a close contact, please do that. Apart from the fine that you might get, you are going to put people at risk if you actually go out and about. So in the places where there are lock-ins, that's a very appropriate approach at the moment. I've lived and worked in a lot of the places, in fact nearly all of them, that currently we are going to take this approach. It's proportionate. It is to stop the spread between communities and also out to communities. So at the moment, this is a tipping point. The main things that I would ask you, get the needle. That's the most important thing that you can do. We do have some communities and some individuals across the Territory that have chosen to not have their vaccine yet. Well, you are putting yourselves at risk. Am I worried about the numbers? At the moment, I'm not worried about the numbers. The rates of people in hospital have gone up because we have very effective treatments, simple treatments that have been around for a long time. Steroids, the things that you give people when they've got asthma and other conditions. We've got treatments, antibody injections. I've used those in the past, very effective for people with susceptibility and, in this case, their antibodies against COVID-19. Very soon in the Territory we're going to have antiviral treatments. I've ordered them through the national stockpile and they'll be here shortly. And those antivirals, like the one for influenza, we can have available across the Territory. Initially it's going to be those who are most at risk, and also to potentially put them in a hub so that they can be then deployed when they're needed. And I recognise at the moment there's weather events across the Territory that limit all sorts of movement, which is a good thing. You get to stay at home, whether you like it or not, but also it's actually limiting the spread. So importantly, we work with our health partners, GPs and the community-controlled sector, to take this strategic approach. And that's what we're doing. It's a new strategic approach. It had been planned. We've had the plans in place of how we're going to do this, and it's going to be the focus on people who are unwell. And people who have no symptoms may not know they're infectious. If people have got mild symptoms, they can be cared for in the community, in our urban and regional centres, and in our remote centres, and partnering with communities to find a suitable place. And I know this because I've been there. Places like an outstation might be appropriate where positive cases and contacts can be, without dislocating people from their homes, their homelands, their cultural responsibilities. The main focus is identifying people who are susceptible to infections, and we've got these lists already in terms of our severe weather events, that we actually know who they are, what their conditions are, and that we can assist them, if required, to be in an alternate place. So at the moment, the focus is on symptomatic treatment. That's the best value. So if you have symptoms, and we've talked about symptoms a lot, but just to remind you, some of them can be very early and unusual, such as diarrhoea, but sometimes it's that blocked nose or headache. With Omicron, it's actually quite common to have a cough and a high fever, like flu-like symptoms. So you need to monitor yourself and also your family for those symptoms, and then get a test. So the numbers at the moment, you might be concerned, but as the Chief Minister said, the numbers in ICU have actually gone down, and the number on oxygen therapy has not moved. And that's comfort to me, and it should be comfort to all of you. Thank you.
Sorry team, still getting used to that. Good afternoon everyone. All the work that's been done to date is about resilience, building resilience for the Northern Territory, for our major centres and for our remote communities. And resilience is something that we need to focus on, because now is the time for the community to step forward and understand the position that we've managed to get you to. The vaccination rate up above what we wanted it to be. The booster, the information is now very clear about how effective that is to you, the mandates in place for that to come, the mitigation that we've got in place with the masks at the moment, again, all in place to help suppress the spread. The move now to a lock-in is about the community resilience that we've been working on, and that's something that we've been trying to build up for a considerable period of time. We will not be delivering food packages to lock-in communities. You have the means and the ability to go to your community store and to provide food to you and your family. The community resilience here is you need to look after those old people. You need to look after those people that are COVID positive. You need to go to the store for them and drop the food off at the gate and maintain arrangements where you don't have to be in contact with them. The strength of family, the strength of culture needs to come to the fore, and that's as applicable in a remote community as it is in our major centres. Our aged care facilities have controls in place not only in our major centres, but in our remote facilities. We are working with the RCHOs, we're working with NT Health to identify who our highly vulnerable are, and we will ensure that appropriate mitigations are in place for any risks that COVID may pose to those individuals. NT Health will be reviewing those that are currently in the Lorraine Brennan facility to see if we can move some of those people to more suitable facilities to enable people who may have some mobility issues and some other healthcare needs to be prioritised in that care. We are working together to build resilience. What you can do as the community to assist in that resilience is go back to the basic principles of maintaining physical distancing where you can, wearing a mask, and also being cognisant of the fact good practice hygiene helps. They're simple measures, and if you can do that, that will go a long way in helping us. The lock-in measures are going to be important in so much as it will allow communities to live as reasonable a normal life as possible. However, we need to stop the movement in and out of our major centres and also into other communities. That way we can continue to manage the spread of COVID at a reasonable pace and ensure the resilience is commensurate with what the risk is. We will be doing random checks on all the major road routes as well as the back roads. If we find people have left community through those roads and are in breach of the CHO direction, you will be fined. It's as simple as that. Don't leave. We're going to work with community stores about restricting fuel access. We're going to restrict charter flights. We're going to restrict commercial transport options into those communities. There are very finite reasons to be able to leave those communities, and we will work together as a community to facilitate that movement if it is required. If it is not essential, it's not going to happen. So prepare yourself and stay at home if you're in those communities. It's 7 days at this point in time. We will make sure there will be high visibility policing patrols on all of our major roads. As we have the resources returned from our border checkpoints, you'll see a lot more police out there doing traffic duties. We'll be targeting grog running, we'll be targeting all sorts of illicit activities, and more importantly, we'll be making sure that the lock-ins are complied with. We'll be working with the land councils who've already offered some additional support, in so much as we'll probably have some sentinels, as in security guards and or other employees who will be based in community that can give police a heads up who's planning on leaving or has left a community, and then we'll go and round them up. And be very assured, we will track them down and we will issue them a fine. The community must come with us. We're also going to explore with the land councils where the communities want to opt in to a lock-in, and if that proves to be the case, we'll work with them about what that looks like. But it has to be based on medical evidence, and the CHO has to be comfortable that the threat of the spread of COVID is a real risk to that community. We'll work with people to do that. We don't want to limit people's freedoms without a necessary purpose to do so. The other element of that, of course, is the current supply issue in the Northern Territory. I can advise that 8 trucks were able to be escorted through some of those impacted roads in South Australia yesterday. I want to thank the South Australian authorities for doing so, that then came into the Northern Territory to start providing a line of supply again. There are also roads, transport activities occurring, as I mentioned yesterday, coming through New South Wales and Queensland, and we anticipate arrivals as early as this afternoon and ongoing. It is likely to be the case that fresh produce should start appearing from tomorrow onwards, and certainly by the middle of the week we should have some sustainable supply unless we have any further detrimental weather impacts. It is clear that there is a fair amount of weather activity occurring, particularly through the Barkly region, and we'll continue to monitor that. But as I mentioned the other day, please, if you don't need to travel in those weather affected regions, please avoid those roads, because many are not passable and you place yourself in danger, and we really don't need the impact on our resources to go and help you in that regard. So the line of supply is being re-established. Again, I don't have a further update at the moment on how long the railway will be out, but as soon as we get that information, we will ensure that we communicate to you. Thank you.
Chief Minister, yesterday the Health Minister was citing that the bulk of cases were still interstate arrivals, and now today we're seeing a pivot away. I'm wondering what's changed in 24 hours?
No, I think it's all been pretty consistent. We flagged there'd be a peak in interstate arrivals prior to the resumption of school. Obviously school's resuming, so we feel we're through the bulk of that now. If you look at our prevalence rate, It's about the same as other jurisdictions, so we wanted to get through that you know, the rush back to start school term, so we've got through that. We're now looking around, we're about par, so we feel we can move away from the border controls. It also frees up around 100 staff, and we can pivot now into the lock-in approach and providing a much more targeted use of our resources to where the need is. So we want to worry much more now about symptomatic or vulnerable Territorians than essentially interstate arrivals who are by and large not unwell. So it's about more putting our care into those Territorians who we think need it.
So does that mean the checkpoint at the airport, we're going to see the staff moving out of that, and essentially interstate arrivals can just get off the aeroplane and enter the territory?
Effectively, there will be some random work done at the airports, and the Commission can describe it if you like, where essentially you check in as you get off the plane, you check in. We'll probably randomly, as opposed to for every flight, have some staff there checking the check-ins. You also still fill out your border arrival form, so you need to declare to us if you're unvaccinated. The same rules still apply to the unvaccinated. It's free entry for the vaccinated, so there is a difference there. But effectively, the airports won't have that same greeting party that we had of all those people. It will be a much smaller number, if any, at the airport, and we'll be doing random audits. You still need to declare, and obviously there's a fine if you falsely declare. So essentially the controls are in place for the unvaccinated still, but basically free entry, effectively free entry for the vaccinated.
Will that include international arrivals as well?
We've always been consistent in having the same rules for interstate as international, except in those circumstances where the CHO or the Australian government's determined a country, and that will be controlled more at the customs point. And obviously, so therefore the same rules vaxxed and unvaxxed.
Just to clarify on those random spot checks, is it the case that if someone misleads the public and who is unvaccinated comes in and doesn't declare that they're unvaccinated, will it be on the matter of them getting caught from a random spot check, or will there be some sort of person to check that status of them?
So it will be random, so it could be a circumstance where someone catches them at the airport. So, you know, if you do that, try and mislead us, lie on your border declaration form, and, you know, basically you're playing the odds no one will greet you at the airport. At this stage, we're looking at random checks at the airport, so it's every chance you get caught at the airport, then obviously it could be on a dip order after that. But I'll have the Commissioner add more.
Yeah, thank you. The dip audit we assess will be appropriate because we'll be able to do some analysis on the individual from the information provided in the form. It is the case, as you critically know, that people have misled us in the past, and we've taken action to issue a fine. But again, I'll go back to the community resilience part here. The community have been very, very good in letting us know who has been non-compliant. Many people know who's unvaccinated in their family, in their friends. They know if they've been travelling, and you can confidentially make a report to us that somebody has not complied, and we will follow that up and be very, very clear. If you have arrived and you are unvaccinated, not only will you be issued the fine, but you will be sent into a quarantine facility and you'll be charged for the time that you're going to be there.
In terms of as well, maybe one for the Chief Minister, this seems like a fairly significant strategic shift, and I'm wondering, when we had a model initially estimating the peak would be first week of February, why not wait for the booster rate to jump a wee bit higher, for school to adjust to having returned to semester, and as well for us to get more antiviral treatment and a better supply of intravenous treatments as well before shifting to this mode? Why now?
So I'll probably pass Dr. Heggie after I say a few words. Health have been talking to us all the way through January. There's going to come a point where prevalence is about the same and we could pivot away from the border checkpoint. The advice from Health is that that's the same, so the rate of COVID in the Territory is now equivalent to the rate of COVID in New South Wales. So it's more that giving a test to someone landing from New South Wales would be as effective as randomly giving a test to someone in the street of Darwin, i.e. not effective. We want to concentrate our resources on those who are symptomatic. In some respects, some of the things you put to us in the question make it even more important to do the pivot now. Prior to the viral treatments arriving, etc., making sure our resources and efforts are going into the symptomatic and the vulnerable. So this seemed a natural pivot point. Prior to this, essentially there was a greater chance someone was arriving from interstate was more infectious than someone here. So we had that net in place. That's one way of describing it, essentially a net there to catch them. We got through that peak of arrivals prior to school resuming. We're now into that start of school term. Now, it is fair to say movement is transmission, and so you could correlate school returning with transmission, but I think we'd be naive to assume if school wasn't on, people weren't moving anyway. So there's going to be movement. And schools are, you could say, almost the safest place in Territory to be. These are highly regulated environments, great plans over a long period of time around communicable diseases, not necessarily just COVID. So very experienced people in how to run and manage these places, arguably the safest places, but some of the safest places in the Territory to be. But I'll have Dr. Heggie add to the health advice we've been receiving over the last few weeks on this issue.
So thank you for the question. It's important. So I think I've reported previously that genomic testing on our cases in the Territory had been trending down with Delta, this is several weeks ago, and Omicron trending up. And that's also confirmed by genomic testing of wastewater as well. Because of that, we're likely to be dealing in the majority at the moment with Omicron. And knowing that that actually is very much more infectious and as previously stated as infectious as measles, but nowhere near as harmful, that making this change now, the supply of antivirals, that's going to be only just days away, because it's a week or so when I asked the National Stockpile to actually release them to us. So this is the agility of approaching it in terms of the vast majority of people are actually not going to be unwell at all. And the main thing is staying away from others so that they don't infect one another, and have every confidence in the treatments that we've got available. And that ICU number going down and the oxygen therapy about the same, yet the numbers of people in hospital receiving these treatments has actually been effective. So I think that this is the time for that approach. We could hold off for much longer, but in actual fact, I don't believe things will actually change. And don't forget those principles that the Commissioner mentioned earlier are very, very important. And I will say that even those alone, although this variant is particularly infectious, actually reduce the risk. And I think the numbers that we're seeing, we didn't see an uptick in numbers, you know, from people who would have arrived a week or thereabouts. A replication cycle haven't gone up.
Just on the per capita cases, though, which seems to be part of this logic, ours is actually higher than New South Wales and Victoria, and I think significantly higher than South Australia as well at the moment. So we have a moment where our cases trend down like in those other states. Yes. Why not wait for the trend down to begin? Yes.
I think that's a very good question also. They're still dealing with, particularly in New South Wales, Delta outbreak and Victoria as well. So I think you can't compare, this is not apples for apples, and I think that we've got an approach of testing when you're symptomatic. That's the most important thing. And I believe that although our rates, you know, it depends how you count them, because some of the other jurisdictions don't count them the same.
Doctor, can I ask you what you know at the moment about the new sub-variant of Omicron? Have we seen it in the Territory, and what information do you know about it so far?
Yes, the BA2, as it's known, I don't believe that we've actually detected it yet. We do genomic testing, sampling on cases. It does not seem to be more infectious, and as far as we know at this stage, not more virulent as in causing harm.
Would the spare rats that we're invariably going to have now that are not testing interstate arrivals, will they be distributed to lock-in communities, for example? Will there be some sort of strategy around that?
Well, I think the approach should be where they're most needed, and that's where you've actually got positivity, and whether it be in a remote location or in a particular setting such as an aged care facility. They're also, of course, used to test a range of people who need to go to work because they're essential workers, and that's a really important approach as well. So we've always actually been ahead of the game when it comes to getting devices that test for COVID-19, getting reagents. We've always done that, getting the RATs and masks. So we're well supplied and well prepared.
clarify, when you say that essential workers will need it as part of their requirements and health bodies will need them in lock-in communities, are you saying that the NT government is going to be providing to NGOs and businesses with that additional supply?
Well, I don't know that we're responsible for supplying the tests, if that's what you're referring to everyone. We do supply them in terms of the cost that they would pay. We have supplied them partners when there's been not enough in a particular location. But I think that no, we've all got personal responsibility in this, and this includes the community generally. I don't know about you, but I've got some in the fridge just in case that I purchased a while ago. So I think we've got to come together on this. You know, it all comes down to personal responsibility.
I want to add to that last answer. In exceptional circumstances, where the Chief Health Officer has signed off on something, we've provided some rats at retail prices because we recognise there's some market failure. That's happened very rarely. And obviously we're currently sharing our rats with Archos in the absence of the Commonwealth being able to provide those rats. So the number of circumstances we're using rats beyond what we've previously thought we might need them for. And obviously we've got school returning, but we already had a rat supply lined up for that, so that won't be resolve this, but we obviously want to make sure we've got rats available for people who need them. We're very confident in our supplies, but as we've seen down south, you should never take your supplies for granted.
We've just heard a lot about personal responsibility. Over the past, since Christmas, we've heard stories about COVID-positive people isolating themselves on their verandas under trees to try and avoid infecting their families. Is it a false dynamic to say that it's all about personal responsibility if they have nowhere else to go?
I've seen a couple of those articles, and I think, like most people, tend to quite distress the idea of someone being isolated under a tree, and we've followed up on it because that's never been our direction or intent. So far, I've not been able to find any of those fact-checked, if that makes sense. We have got places available where we can send people who are COVID positive. Now, what could be true is occasionally people like sleeping outdoors, especially in the centre of Australia. That's just a reality pre-COVID, post-COVID, during COVID. But there's been no isolation orders to verandas or trees, and if we're aware of anyone who is positive in a situation that is not good for their health, then there's absolutely a direction for them to be moved to a place where we can provide that care. So we are doing that work, and if anyone's out there is aware of a situation where someone might be COVID positive and they feel that their health is not being looked after the right way in terms of the setting that they're in, we're more than happy to prioritise that and get them to a place where we can care for them. We have got places we can care for people. One of the challenges, full stop, whether it's a cyclone or COVID, is movement and transport, but we've got assets that we can use for those purposes. So if there's anything out there, anywhere anyone got any stories, we're happy to follow it up. So far, my fact-checking, the tree story, for example, haven't been able to get any of that fact-checked. I've heard the veranda story, but when we follow that up, there have been occasions where people have chosen to sleep on the veranda that night. That's their choice, but they want to be in an alternate location. Their health needs to be in an alternate location. We've got those alternate locations available.
From my understanding, they were waiting for health to pick them up or provide alternative accommodation, and that's why they were in those circumstances for upwards of 48 hours.
Yeah, I'm happy to follow up on different stories, but I've got to be honest, those stories distress me. I don't want those stories to be there, if that makes sense, and we've been following up when I get them, and I've been, so far, it all seems to, yeah.
In terms of the way in which, and just I may have misheard it here, but the rules for someone who's COVID positive or a close contact in a lock-in community, are they bound by any rules around isolating?
There's still stay-at-home orders for them. What we're saying is, under a lockout or a lockdown, there's stay-at-home orders for others within that community, and a lot of effort goes into essentially managing or enforcing that. Now, there's two things. One, that's the use of resources that we think now is not the right use of resources, and there's essentially a degree of non-compliance that in a remote community we understand. We're not criticising people, it's just a reality of a remote community, essentially one large household, etc. So this is more trying to pivot our resources into where they're needed and providing a different focus on essentially the borders of the community or the bubble that's been identified. So what we're saying is let's minimise or moderate any risk of spread out of that community. I don't think we can stop it altogether. This is something we've discussed with the Commissioner, Land Council and others in the past. There are a number of canny people who are local residents and they know their way around things. So I think it would be false if I ever said to you we can stop all movement out of the community. I'm sure the Commissioner can add to this, but we're going to do our best to moderate movement out of the community.
Were the land councils and ARCHOs and other community-controlled organisations consulted on these decisions before they were implemented?
Yeah, we've been talking to them a lot about different models. Well, I don't know if we use the phrase lock-in, so that might be new to them, the phrase lock-in, but we've been talking to them about how we might be able to do different travel rules, and so this is definitely part of our conversations with them. I know the Commissioner mentioned earlier the concept of security. Land Council put on board the idea of them employing some security, and the Commissioner said, well, if that was the case, this is how it would work. So we've been having those kinds of conversations about how at a practical level it would work. I know the Commissioner's had some of those rogue conversations with the Land Councils, for example. So I can put the Commissioner back on if you like, just to touch on some of that.
Yeah, we're conscious of the fact that people have got all manner of ideas and thoughts on how things can be done, but we've got to be the ones who can actually make it enforceable, but also make it operationally effective. I think we've got to be upfront. There's a fair bit of catastrophisation that goes on. The one thing that we've got on our side is the Chief Health Officer. He knows the facts. He gets the information from the CDC. We can assess what's going on. So we actually need to take a little bit of the catastrophisation out of it and look at what the real facts are. And the Chief Health Officer has spoken about it today, about ICU numbers dropping. We are putting mitigations in place. If we put road borders in place, then that ties up police resources to those. Whereas if I have mobile, guided resources through community intelligence, taking the community with us, allowing a community to make a local decision based on the local information and ensuring that it's appropriately implemented, we can achieve the same outcome, but also diminish the harms of alcohol going into a remote community, for example. So we are conscious of what the community expectation is. We also have to be conscious that not every advocate speaks truly on behalf of every Aboriginal person. Let's be upfront about that. And what we're doing is sound and commensurate. And I think what you'll see is our track record speaks for itself where we've arrived today. So trust in us where we're going into the future.
Just on that though, I mean, in terms of the groups that you believe are catastrophising, who are they?
I think it's obvious, and I don't need to call out each and any individual, but what I am saying to you is look at the track record that's got us here today. It's exceptional across the country, let alone the world.
And many people, I think, would agree with that, particularly given the low amount of deaths we've had in the Northern Territory and the fears of
against a highly vulnerable backdrop. So, you know, anyway, important question.
So, and just on the matter of how resources are going to work, so there's going to be police consulting with people in communities. They're going to work off tip-offs as well as the Land Council around who's moving in and out, and that's how you're going to catch people.
Yeah, not just consulting with community, but community will guide us. As occurs with grog runners, as occurs with people who seek to run illicit drugs into communities, as with people who know that family and domestic violence occurs. We've got really great established networks with our remote communities, and we'll build on our bush copper network. But as I say, I know the Land Councils are really keen to partner with us on this, and I'm very keen to partner with them on this. If we can put sentinels in place that have got an eye on the community, people coming and going, they can give us the heads up. They can be our eyes and ears. There is no greater partnership with police than community, because we are community, community are us.
Are there other elements that are putting stressing on policing and perhaps even health resources, but I guess particularly in your own field, just are there other pressures on police resources that have meant that there has to be a bit of a shift away from door-to-door COVID monitoring to something different?
Well, again, I think that's part of the great irony from one of the earlier questions about people sleeping under verandas and the like. There's ample evidence about how much work is occurring across the board from the whole of NT government response to treat everybody on an individual case-by-case basis, and we can only act on the information that's before us and the accuracy of that information. What we have to make sure that we're doing is dealing with this emergency response. But as I've spoken about, what is clear is we've also been working on building community resilience through part of this so that we can live with COVID. That's always been part of the clear strategy, and I would suggest that we're well on track to achieving that. What we need to make sure is those people who need our help get our help, whether that's police, whether it's health, whether it's any other service that we provide, and I think we've got a really, really good track record to demonstrate we've done that superbly.
Police Commissioner, can I just ask, you mentioned at the top with the supply chain issue that South Australian authorities were able to get some road trains through. I guess, is that good news? Are we likely to see the Stuart Highway return to a little bit more normality down there in South Australia with getting road trains through?
They're assessing today what sort of damage those 8 vehicles may have done to the road. Obviously they've had to create an alternate route, and so it won't have the same stable base that a bitumen road will have. And of course it's had heavy rain, so it's quite soft underground. But my understanding was they escorted those 8 through. Now they're going to do further assessments on whether that alternate route is going to be viable. I don't think we'll see it at full noise as it's previously been, as if it was on the bitumen, but at least we've got the trickle starting. And as I say, the current advice is encouraging that with the alternate route that's coming through New South Wales and Queensland, our stocks across our stores in the Territory should look a lot better by Wednesday.
On the matter of supply, it seems like our remote communities are actually doing a lot better with this because of their forward plan they typically have in place. But then it's the urban centres where there's these big shortages we're seeing in pretty much every shopping centre. Is it the case you'd look at targeted goods for dropping them?
Look, I just think there's some sad elements that have come through of human behaviour through COVID, and it's the I'll worry about myself, Jack, thanks very much. And you know, that's where we've seen toilet paper and the likes getting surged upon. Again, this is what I talk about community resilience. If we actually do it the right way, if we only take what we need, there's going to be plenty for everybody. All credit to the major chains. They've already implemented some controls on quantity on certain products, which are highly sought after products. So again, we're all working together on this, but as I say, if you're the one who's got your chest freezer at home and you've got 6 months worth of supply, well, you know, good on you, but was it really necessary?
If there were more weather complications, what would the response, what are some of our other tools?
We've got a graduated response. I mean, if we get to a critical need where we simply have no fresh food supplies, then through our EMA arrangements, emergency management arrangements in the country, we can request some air transport. But as I've indicated previously, that's not simply a case of we're going to move, you know, 1,500 pallets of food in a single flight. We've got to work through what the capacity of those is and make sure that the supply chains are appropriate. But the Northern Territory can rest assured we are expert in emergency management. We've demonstrated that time and time again. We're expert where roads get cut off. We make sure, as you've just pointed out, remote stores have adequate need to survive through our weather conditions and our seasons, and the wet season is one where they've maintained stock. But equally, even in our major centres, our non-perishable stock is not at risk. It's just our short-term fresh food supply, which in the space of 7 days we'll hopefully have restored. Thanks everyone.
Thanks.